Okay, so today we'll be hearing from Jack Buckland, who is a social prescribing locality manager. Thank you, Jack, for agreeing to come along today. It's really good to see you. And once Jack has finished speaking, there will be time for questions from the floor. So without any further ado, I'd like to introduce you to our speaker. Welcome, Jack. It's over to you.
Yeah, thank you very much for having me. Yeah, so my name's Jack, everyone. I'm the locality manager for the help and care social prescribers in Weymouth and Portland and Jurassic Coast. So there are 3 other equivalents to me across Dorset, and we are one of the social prescribing providers in Dorset PCN. So we're in pretty much all the PCNs across Dorset, and if we're not directly involved and providing the social prescribers, then we work very closely alongside the social prescribers who are provided by the network itself. I do have some slides that I can try and share. Didn't go to plan last time, but I'll give it a go. I think we're 1 step ahead than last time. I've come up with a screen. Let's try this. So, can you all see my PowerPoint?
Looks brilliant, Jack.
Oh, it's worked this time. That's a bonus, isn't it? Right. Let's go to full screen then. Okay. So I'll just give you a bit of an overview of social prescribing in general. I won't shine too much of a light on help and care. We're just one of the providers in Dorset. But it will hopefully just give you a bit of an idea of what social prescribing is and the sort of cases that we work alongside and how we can help both individual patients and practices themselves as well. So we'll give this a go. We've moved on to the next slide. So again, we're doing all right. So yeah, just a very brief overview of what social prescribing is. And what we're trying to do really, in essence, is to plug the gap that's very prevalent in healthcare at the moment, whereby there are lots of issues that patients are facing that can't necessarily be helped or solved by medicine and clinical approaches alone. So that's why this word non-clinical is a bit of a sort of a key word for us. Sorry, there's a bit of background noise there from someone. If you wouldn't mind just going on mute. That'd be marvelous. Yeah, so the idea is that medicine can't necessarily solve all of the patient's issues alone, and sometimes you need that kind of helping hand of non-clinical approaches, which aren't necessarily quite as prevalent as they should be at the moment. At the moment, we have quite a medicalized approach to people's problems, i.e. if they come in with mental health issues or worries or anxieties or whatever it may be, we obviously go straight in for a medical or a very directed clinical approach. And so what social prescribing aims to do is to kind of offer that different avenue, which isn't there to replace the medicine by any means. It's just there to work alongside and offer that sort of different avenue that might not have been presented at first. So the kind of the underlying ethos behind it is that we have this person-centered approach. So whatever the person is referred into social prescribing with, whatever issue that might be, we tend to look at it as, okay, we always start from scratch with that person. So we mentioned that, that referral has come through based on weight loss or anxiety or housing or whatever it might be. But then it's up to that patient to kind of decide what matters to them and what do they feel would empower themselves to help their own circumstances along the way. So it's not just being directed clinically, it's also that patient having their input too and helping them to feel confident that they can actually help themselves as much as clinicians can help them as well. So that's kind of the overview of social prescribing. Here is just a bit of info about people that can access the service. So this is particularly for the help and care social prescribers. So anyone that is registered in a Dorset GP surgery and is over the age of 18 and be referred or self-refer to the help and care social prescribing service. And we'll go into details of that later on when we look at how to get in touch. But if it's not help and care that are necessarily the most prevalent social prescribing provider in your network or your GP surgery, all you need to do is quote social prescribers, and there should be someone employed in your GP surgery who will be able to help you with any of those related issues. But from a health and care perspective, it's registered in GP Dorset and over the age of 18. So this very unfortunate non-binary figurine here, this person is going through an awful lot, as you can see. Quite a few issues there, not necessarily interlinked, but they're all prevalent. So, you know, they're isolated, they might be a carer, they might be in pain, they've got a series of long-term health conditions that they're battling, their finances are in a little bit of a pickle, and they're feeling genuinely, you know, depressed. This is kind of a classic case, and unfortunately, what I would say is, you know, a fairly classic case, as I said, because people do have all sorts of things going on in their lives that aren't necessarily as easy to, you know, put a finger on as maybe, say, a broken leg or, you know, being classed as anxiety. There's a whole range of issues that interlink there, and so it's up to the social prescribers to help them understand their situation, which can be quite hard at times to kind of get your head around where it is that you need to go and what steps you might need to take. So this picture just kind of conceptualizes what a patient might be going through. So they might come in with one issue, but actually there's a whole range of things going on in that person's life, which all might need a little bit of consideration. So based on the different roles of social prescribing, we've got health and wellbeing coaches, and we have link workers, and there should be a third circle on there now as well as care coordinators. So the link workers are there to assist patients with the more kind of practical issues that maybe medicine can't help on its own. Things that are quite common for us are things like housing worries or finances. Maybe they don't know what benefits they're entitled to. Perhaps they're quite socially isolated and they don't know how to get out into the community or link up with social groups or whatever it may be. And it's up to the link worker to assist that person and help them to try and find what might work for them and might help them make their situation a little bit better. So it might be holding their hand through a certain process with finances, so that by the end of that case with that person, they feel more confident to handle their finances independently. So there's always this kind of self-management ethos behind it, that, you know, we help them for a period of time, but we don't want them to become reliant on us. We sort of want them to, you know, develop that confidence so that they can help themselves in the future as well. And in a very similar respect, we have health and wellbeing coaches, and they're slightly different to link workers in that they don't really deal with the practical issues as such. They mainly deal with helping that patient unpick the more complex issues that are going on there. So like I said earlier, you might have someone with a range of issues or challenges in their lives. And sometimes it can be quite hard to know maybe which one to prioritize or which one to start with first. And it's up to the coach to sort of help them set goals, plan their day, you know, get a bit of routine, whatever it may be. And they'll sort of work with people for typically a longer period of time than the link worker, just to sort of help them step by step feel like they can take more control over their own health. And as I said, there should probably be another circle in there for care coordinators. We at Help and Care don't employ very many. There's only a couple at Help and Care coordinators. But for example, in Weymouth and Portland, there are quite a few that are employed by the PCN directly. And they're sort of there to help the patient with their clinical kind of pathway and help them navigate that. So they work very much alongside the health and wellbeing coaches and the link workers. And, you know, for example, in Weymouth and Portland, we have a shared task box in System 1. So all the referrals go there. And then we as a team triage them and work out which professional might be best to work with that patient. And at the bottom, you know, it's just this idea that there's no wasted conversation. And sometimes, you know, in the clinical setting, things can feel a little bit directed and a little bit rushed. And we sort of try to mitigate that by offering them a little bit longer with their appointments. So at Help and Care, we offer them 45 minutes of time to really delve into what it is that's going on for them. Because sometimes you need that time just to really unpick what is going on there. And then what we often find is, you know, the first couple of sessions are maybe 45 minutes. But as they start to work with us and they become more confident and they have a bit of a focus, a bit of a direction, those session times start to reduce. And then by the time we get to the end, it's usually just a check-in, and then they're ready to go off and hopefully manage it themselves. But yeah, it's the idea that we kind of offer them that conversation to really unpick what it is that's important to them and help them build confidence to go out and do things on their own after our service. So just a very sort of brief overview of how that system might work. So, we'll listen to their story and get an idea for what's important to them. What is it maybe that they want to change in their lives? And then if it's the link worker, they'll usually go away and do a bit of badgering. So it might be that they link them to local groups or find the right service for them and help link them up with that. And if it's a health and wellbeing coach, it'll be really delving into not necessarily the psychological style of things. It's just a conversation to work out, okay, if we considered all the main points here, do we feel like we're in a position whereby we can make a bit of a plan and sort of work our way up to an end goal? The end goal might be something like leaving the house. If someone's got anxiety, they might have been housebound for years, some people, and it might just be looking at, okay, well, how do we work that up to leaving the house in baby steps? Is it that you spend a little bit of time in the garden? Is it that you approach the end of your street, whatever it might be? And it's just this idea that if we put too much direction in that, it might be too much for some people. So that's why we always base it on what do you feel you're able to achieve, and then that's our agenda. So rather than saying we expect you to do this, that, and the other, it's more, what do you feel you're able to achieve, and then we'll support you along the way. And the last little bit on here was just for any barriers. So rather than just sort of going, yep, that's ticked, done, you're able to do that on your own now, it's okay, well, what hasn't worked in the past and what has gone wrong? So maybe you have been confident before, and then your confidence has been knocked by a barrier or by a challenge that's come up, and we sort of look to mitigate those barriers. So how do we prevent you from stumbling over that barrier again in the future? And then that's sometimes where you see the real progress, because when they've identified that barrier, they know how to deal with it, and then they don't stumble over that barrier again, and then their progress really does start to go on the upward kind of direction. This is a video that I'm not going to play because it rarely works, but this is on our website, which I'll obviously direct you guys to at the end. And it's just to sort of give you the overview of what a classic case might be with a social prescriber, how that conversation would go. So if people like video sort of format, there is a video for people to see on the website. And with regards to getting in touch with us at Help and Care, if you'd like to refer yourself, or if you're a professional and want to refer a client, there is a telephone number to our single point of access team, or you can go to the website and do a self-referral or a professional referral form as well. And that, I guess, is all I have to say on social prescribing in general. I'll happily answer any questions and provide any examples should you wish. I just need to try and stop sharing my screen. Voila.